So you've probably heard by now that Dr. Oz is most likely going to be running CMS, the Centers for Medicare and Medicaid Services. And when you think about CMS, that is the majority of what healthcare is in this country currently. It is Medicare, it is some overseeing on federal funding for Medicaid, it is Obamacare, the ACA, so everything around health insurance and healthcare, what we consider modern healthcare, pretty much is run by CMS. So what is it going to mean to have Dr. Oz running CMS? And so I've given this some thought, and I've also looked into some of the history of Dr. Oz, and I want to give you some of my thoughts today. So the first thing I'll tell you is that Dr. Oz was born in Cleveland, Ohio. His parents were Turkish immigrants. Both of his parents were in healthcare. His father was a thoracic surgeon, and his mother was a pharmacist. And then they migrated to the United States, and he was born here in the United States. So he comes from a healthcare background. Then when he went into school, he went to Harvard University. Clearly he's very intelligent. He graduated magna cum laude from Harvard University in the mid-'80s. I think it was like 1986. And then he went on to medical school. He attended the Pennsylvania School for Medicine, where he graduated there, and then did his residency in general surgery and became a cardiothoracic surgeon, and then began to teach at Columbia University. So he was a professor at Columbia University. And all this happened when he was very young. I mean, he's clearly very, very intelligent. It doesn't mean you have to agree with where he stands on policy, but you cannot dispute that he's a very intelligent person. That's when media began to become his future. He, as a young professor at Columbia, he was asked by Oprah Winfrey to come on her show and to begin to talk about some of the healthcare things that were happening in the country. And then he became a kind of a fixture when talking about healthcare on the Oprah Winfrey show, and that led to the Dr. Oz show, which became his own talk show around healthcare and other things, and that has been on the air for a long time. Now, in full disclosure, I don't think I've ever watched an episode of the Dr. Oz show. So I had to do some research on Dr. Oz to even understand where he stands on certain policy things. And I'm going to share that in just a minute because I think that's very interesting. But first I want to talk about who he's replacing, because one of the criticisms that I've already heard about Dr. Oz is that he is a TV doctor, which clearly that's not true, even though he has focused on media. Rather than practicing, he is a doctor, and he's a real doctor, and he was a professor at Columbia University. I mean, that's clearly not true. So when I hear that, I think, okay, that's a biased source trying to mess with my mind and tell me what I should think, which I don't like those. I like to think, if you can't tell about me, I like to figure stuff out for myself, and I like to read about things and form my own opinions and not rely solely on someone else's opinion. So who's he replacing? Well, he's replacing Chiquita Brooks-LaSure. And from my standpoint, and the standpoint of the majority of my industry, she has been a complete disaster in that role and has just regulated the most bizarre things and pushed for massive, massive, massive regulation that has damaged the industry. And in some cases has improved the industry, but overall has damaged the industry, and particularly for independent insurance agents. The amount of regulation she has pushed upon us to do crazy things, like if you're one independent insurance agent who works by yourself and helps people in your community, she forced us to record every phone call that we make and retain it for 10 years. You have to retain your phone calls for 10 years. And if 9 years from now, CMS calls you and say, hey, we want to know what you talked to about with Miss Susie while you were on your cell phone and she was on her cell phone at home, we want you to reproduce that recording. I mean, we're not massive publicly traded call centers. It's just one insurance agent helping their neighbors. Here's another one. Your neighbor calls you and says, hey, can you help me out with my insurance like you did last year? Yeah, I'd love to, but I need you to sign this paper and you need to wait 48 hours before I can talk to you about your Medicare. I mean, these are silly, silly rules. People with Medicare, we act like they're all geriatric and they can't think for themselves and they all have power of attorney. Someone else has a power of attorney over them. That's just not the case with the majority. The majority are very intelligent people who should not be treated like children. And if they ask a question, we should be able to answer it. So these kinds of rules are just ridiculous. Now, this is just what we have faced as insurance agents, but companies like insurance companies have also been regulated in crazy and wild ways. and it has impacted them. And not only regulated, but also all of the funding that was put in place to keep Medicare Advantage above, with costs of healthcare rising even more than the cost of than the average cost of goods. The CMS limited and reduced the funding to Medicare Advantage. So very, very strange things happening at CMS. And Chiquita Brooks-LaSure, why would this be happening? Well, when I hear people say, well, Dr. Oz, he's just a TV doctor, then let's apply the same filter to Chiquita Brooks-LaSure. Chiquita Brooks-LaSure, she went to school and studied politics. Her undergraduate is in politics. And her master's is in public policy. Okay, why is this person running healthcare? It makes zero sense, except that it was a reward for her. And why? Because after she studied public policy, then she got into politics in Washington, D.C., and she was an intern, she was employed, and she worked on the Ways and Means Committee as an employee. So she was part of the whole establishment, never elected to anything, just working behind the scenes, working for senators and what have you on the Ways and Means Committee. And she was one of the individuals who helped to write the Affordable Care Act bill. So she is one of the authors of the Affordable Care Act as a public policy expert and with a master's in public policy. So this is not the kind of person with the kind of background that you want running all of healthcare in the United States. It doesn't make sense. And so when I hear criticisms about Dr. Oz replacing her, I just dismiss those entirely. Know, I am worried and curious and want to understand, what does Dr. Oz stand for in healthcare? And fortunately, we know a little bit about that because Dr. Oz ran for Senate. He wanted to be a senator in Pennsylvania in the last election cycle. He lost that race. But from that, we learned quite a bit about his public policy. And I haven't watched his show, like I said, but I've read up on him to understand what he campaigned for and what his public policy was. Now, some of this may be controversial. You may like it, you may not like it. But at least we have an idea of what to expect, and we would have someone who understands healthcare running Medicare and Medicaid and Obamacare and et cetera. So here are some of the things that we know about his public policy stances. Dr. Oz likes Medicare Advantage. He is for funding Medicare Advantage. He actually, at one point, he had talked about Medicare Advantage for all as an option for healthcare in this country instead of Obamacare. That's an interesting thing. I'm not sure how I feel about that because the amount of funding it would take to do that is extreme, right? But he likes the idea of private and public partnership in healthcare, which that's what Medicare Advantage is private and public partnership in healthcare. I would expect based on that we'll probably see if he actually becomes the administrator for CMS, that we would see more policy to strengthen Medicare Advantage, which, Medicare Advantage, about approximately 53 to 54% of people with Medicare now have Medicare Advantage. Only about 20% are on original Medicare with a Medicare supplement. Many have other coverage through work, or they have Medicare and Medicaid. But by far, the majority of people with Medicare have elected Medicare Advantage. So I would expect that Dr. Oz would continue to strengthen Medicare Advantage and protect Medicare Advantage. Speaking of healthcare, right? You can tell that I'm right by UMC Medical Center in Las Vegas here. So, yes. So he would probably strengthen Medicare Advantage. Would he push for Medicare Advantage for all? I don't know. He's not the one to make that kind of policy. Obviously, that would happen in Congress. But that's something that he has brought up in the past. Maybe not his total stance. He is conservative in nature, conservative in spending. He likes public-private partnership, and he has criticized original Medicare for its inefficiencies. He's criticized it for the amount of waste. I think there would be a heavy focus from him on fraud, waste, and abuse in Medicare. So those are some of the things that I would expect from Dr. Oz. Of course, we don't know, and some of this is set from the top, and from some of the public policy that comes out from Washington, from the White House. But that at least gives you an idea. Am I excited about it? I wouldn't say I'm excited about anything at this point, except I am excited that there would be a replacement of who currently runs CMS, and that hopefully there would be an effort on policy that makes sense instead of what we've seen in the past.